is the latest that's coming in from Maharashtra, where the government is now making an attempt to reduce the number of passengers who will be taking public transport, whether it's railways or buses, state transport buses and private buses and even metro trains. So in Mumbai, for example, best buses will not allow passengers to stand, no standing passengers allowed, to ensure that the bus doesn't get too crowded. Similarly, there are more norms which are coming in. Government offices will also look at lower attendance. Mayuresh has more details. Let's go across to him. Mayuresh, what's the latest that the state has decided, and is this only for Mumbai right now?
No, the state government has decided to keep the attendance in state government offices by 50%. The teams will work in a rotational day. Also, as we have been given to understand by the government, that even the BST buses, which also carries out the standing passengers. So from tomorrow onwards, there will not be any standing passengers which they will carry out. Even the special arrangement will be made for the setting. Special sitting arrangement will be made in the BST buses so that there will be a sufficient gap between the two passengers. This entire attempt which Maharashtra government is making so that to just reduce the crowd, reduce the number of people who are using the public transport.
When will this be effective, Mayuresh?
We have been given to understand that from tomorrow morning it will get affected.
Okay, and what about the trains, the local trains and metro trains? Is there any decision there yet?
Our government is making all attempt to reduce the crowd which is using metro trains, local trains, as well as the state transport buses which travels between the two cities. So even government is making an attempt to reduce the number of passengers, but they have yet to come up with the concrete plan. But yes, they are sure that they want to reduce the number directly by 50% of the passengers.
All right, Mayuresh, thanks so much for bringing us this update. So that's the latest coming in from the Maharashtra government. Remember, Maharashtra is actually the state with the highest number of cases right now, 43 cases of coronavirus in the state of Maharashtra. And so all efforts now being made to ensure more and more people stay home, do not travel, and even if they get into buses and trains, the buses and trains don't get too crowded. So, for example, in the buses, the BST bus has decided in Mumbai that no standing passengers will be allowed. Once those who are seated have taken all the seats, then the others will have to wait for the next bus. Thanks so much, Mayuresh, for bringing us this update. Well, let's get back to our top focus through this week. All of last week, we've been focusing on coronavirus and the war against coronavirus. Tonight, our focus will be on how to deal with it and just how long will we have to live our lives in this social distancing manner, in this isolation. That's an interesting point, and many people have asked us in the last couple of days just what is it going to take and for how long. Now, first let's look at the situation. As we speak, across the world, number of coronavirus cases have surpassed 2 lakh. Claiming about 8,000 lives, although thankfully 82,000 of those who were detected with this virus have also recovered. So if 2 lakh tested positive, 82,000 of those have recovered. In our country, 151 people so far have been tested positive for coronavirus. Now, given the severity of the situation, India has gone into a self-quarantine mode where we've decided to suspend incoming travel from a large number of countries, from all of Europe, from UK and Turkey, from a lot of nations in Middle East as well. We have decided to completely suspend travel from them. We've also locked in our land borders, come in with tougher visa restrictions. All those now landing in our country will have to be quarantined mandatorily for 14 days. You could be quarantined at your home if you're not showing any symptoms, but everybody who is now coming from abroad will have to follow these rules. But it's not just this, viewers. We've quarantined ourselves from the world. Within our country also, we have to start taking measures. We have to start encouraging social distancing. A lot of people are now working from home across offices, across big cities and small cities. Many people are being asked to work from home. Many people are being asked to cancel their local domestic travel. Restaurants have been told to put basic distance between different tables. Pubs and clubs and swimming pools and parks, gymnasiums, museums, cultural activities, all of this has now been shut down. Why is this so important? Aarti is joining me from the newsroom to help us understand why is social distancing so crucial in our war against coronavirus. Aarti?
Tanvi, we've seen so many people who actually take it very lightly and they say, well, it's okay, I'm not showing any symptoms. The person I'm meeting is not showing any symptoms. The restaurants are going to be empty anyway. I might as well go there. We've seen people who have been escaping from quarantine. Now, these are things that are actually endangering a lot of people's lives in the long run. I'm going to tell you why, and this is purely a statistical model, and this is going to help us understand how the consequences are, how this is actually a domino effect, and how you endanger other people's lives. Now, if one person is infected and he or she meets 2.5 people, now of course, like I said, this is just a statistical method, right? If you meet 2.5 people, within 5 days, you stand to infect them. The consequences of that, though, are far more alarming because within 30 days, you end up infecting 406 people. This is exactly why it is strongly advocated that you stay indoors, you avoid unnecessary travel, you limit the number of people that you meet. Now, similarly, if this 2.5 were to reduce, if you were to meet fewer people, and that's exactly what social distancing is, if one person with 50% less exposure was to infect just 1.5 persons, right, in 5 days, within the next 30 days, only 15 people are affected. That's such a huge fall from the potential 406 patients that would suffer because of your irresponsibility, because of your carelessness. Now, let's move further. If we go even further, if you meet even fewer people, if there's just one person, and that person, in fact, meets even fewer people, that's 0.625 people are infected. Again, like I was saying, this is a statistical model. Within 5 days, with 75% less exposure as a result of social distancing, within 30 days, only 2.5 people are infected. This is the consequence of your decision on whether or not you decide to go out tonight or tomorrow, say, well, it's okay if I endanger my life and other people's life. This model tells you exactly what happens, and this is what you need to consider before making that decision of stepping out tonight.
Yes, absolutely, Aarti. And this is what people need to keep in mind when they travel. This is what they need to keep in mind when they socialize. This is what they need to keep in mind when they run away, when they're supposed to be in home quarantine, when they run away from airports and they're supposed to be tested and they're supposed to follow the procedure. You need to keep in mind the larger damage that you're doing to the entire nation and this world because you are not being responsible enough. Thanks, Aarti, for that. So social distancing essentially is what public health officials are now implementing all over the world to ensure that contagious diseases don't spread. And those who may have weak immunity, the elderly, the children, those suffering from medical conditions don't get infected because someone in that crowd has been infected. Tonight, we are going to focus on just how long will we need to do this and how long should we be prepared to be in this kind of a situation. Can this really become the norm? Many are also asking that question. Let's go across to our panelists who are joining us right now. And I want to say good evening to Dr. George Varghese, Senior Consultant in Medicine and Infectious Diseases at the Narayana Health. He's joining us from Bengaluru. I've also got Dr. Anand Bhan, who's a researcher with Global Health, Bioethics and Health Policy, and Dr. Shiban Ganju, he's past Senior Consultant for University of Chicago Ingalls Hospital. And we have Dr. Amish Vyas. He's actually working, we're told, in a quarantine camp in Shanghai, and he's joining us from Shanghai right now. So let's go across to Dr. Vyas and learn from what China has seen and how they have tackled this situation, Dr. Vyas. We're just trying to understand how will this work for the rest of the world, what China has been battling for the last couple of months.
Hi, good evening. I would like to say that for the couple of weeks, if we start from December, initially everything has been locked down in China, and they started from from the street level, community level, from a district level to a state level, and they completely locked down everything. And besides that, there was strict monitoring every street, every home, and it successfully majority now. Majority of China is like out of lockdown, and life is returning back to the normal. So the prevention is the key of getting back towards the normal life. This is the first and most important thing. If we see that what's happened in China now, like where I was working in a facility, almost everybody has been released, and now majority of are those who are coming from outside of China. In China, there is no new cases recently.
Right.
Just because of the isolation and quarantine.
Yes, so when you say that now people are out of the quarantine camps and they're slowly getting back to normal life, what does that mean? Are they still following some norms of social distancing, less socializing, not going to public places?
Yeah, yeah. The dining facilities in the restaurants, the other common facilities, they're still not allowed to be as usual. And but the public transport is now running smoothly, normally, fine after the almost 1.5 months of lockdown. And recently, like just because of like 14 days of zero case recently, they've started many of the just the schools are not started yet, because schools, they have the population, the distance between the kids being possibility of getting infection is very high.
Right.
So only the schools, universities haven't started yet, but other places they have started working. Also, like some of the hospitals are still not like nursing homes are still, they are in a lockdown.
Yes, in fact, let me go across to other panelists, and Dr. Vyas, I request you to stay on with us. Dr. Varghese, just to what Aarti was just telling us a short while ago, why it's so important to follow these social distancing norms. So what's your own understanding, especially in a country like India? If we don't isolate ourselves and don't follow the norms, and stay at home and we're asked to quarantine ourselves, what could possibly happen?
We are probably in the so-called phase 2, which people talk about, of the infection at this point of time. I really don't think there is evidence to strongly suggest that there is community infection at this point of time. And the ICMR has been doing some pilot studies from influenza-like illnesses in the country, and we have to kind of believe what is being said. And the statement is that community spread as such is not a major issue at this point of time. Is it likely to happen? The answer is probably yes, because that's what has been happening in most parts of the world. Now, this concept of social distancing is actually tried out fairly in Mexico during the 2009 H1N1 epidemic, and it was quite a useful tool to decrease the number of infections. In fact, the data from there suggests that there was about 40%, possibly around 40% reduction in infection with the concept of social distancing. It's a very hard thing to do, and in our country, even harder, because our cities and other places are very crowded. The density of population is very high, so it's not an easy thing to do. But we need to be rational and try and do that. In terms of rationality, also, we need to understand that when we kind of bunker ourselves and get a phobic mentality, it is actually probably not the best thing to do, because the fact is that life has to go on. So it's a balance between social distancing, isolation, and a mixture of things, where understanding that many people do not have the luxury of social distancing to be followed. And once the epidemic moves into the community, we are in for a harder time. And that the community spread has occurred quite clearly in areas like Italy and possibly Spain.
Right.
Okay, so it's a real fear, besides, of course, China. China seems to have curtailed it, but they are very drastic in their steps.
Yes.
We, being a democratic country, cannot use drastic steps. And the density of population actually in India in the cities is probably even worse than many areas of China. So these are the realities of the balance. So it's a mixture of not getting into a bunker mode and having common sense.
Yes. Okay.
And giving the have-nots a chance. If the well-off start hoarding food and other supplies, there is a major problem. Similarly, even hospitals are finding to get basic supplies like protective equipment very hard to get because for two reasons. One is people are hoarding. And secondly, many things are manufactured in China. The raw materials actually come from China. And therefore, it is hard to manufacture even basic things like protective masks when the raw material is not coming.
Yes, absolutely. So, okay, let me take this point by point. You've made some very interesting points there. Dr. Shiban, obviously, it's still uncharted territory. There is a lot of study that has been done, but we still don't know how it may unfold in different countries. Our case could be very different from what China saw, and Korea saw, and Italy and Spain have seen. Many people ask, how long will we have to live our lives like this? Should we prepare ourselves for 2 weeks? Should we prepare ourselves for 2 months? Or could there be a possibility that this social distancing becomes a norm for longer than that? Dr. Shiban?
I think we should prepare ourselves for the worst case scenario if we want to really avoid a big epidemic. We should be prepared for many months of this virus. Even if it subsides, is likely to reemerge like any other virus when the atmosphere is conducive. Social distances should become a norm and a habit for most of us to avoid this and many other similar infections.
So when you
one line, we should be prepared for many months of social distancing.
How do you envision that kind of a lifestyle, if you can just help us understand? Many, many months of not visiting public places or not taking public transport or, schools and offices. There's so many parts to this. How would it be? How could it be?
It will be very difficult, but the minimum you can do is maintain 6 feet or 2 meters of distance between two people in any gathering or any classroom. Number 2 is wash your hands frequently. Number 3 is when you cough into your sleeve and not into your hands. Number 4, avoid strangers who you don't know. Because the danger is mostly from the undetected cases. People who are obviously symptomatic, it's easy to avoid them. But how do you avoid a person who has no symptoms? And therefore, a touch of paranoia will be very helpful in containing this epidemic.
Yeah, and I like how, calmly and mildly you're putting it, a touch of paranoia may be there. But, just to pick up on the other point that was made, the fact of the matter is, Dr. Shiban, that in our country, it could become very difficult with the kind of population density we have, with the kind of work lifestyle that people have. Most people take public transport to get to their offices. Will that become a big challenge
then? Yes, it will, because the healthcare infrastructure we have is not adequate even for normal day-to-day living. And if, God forbid, it becomes a disease which attacks many people than now, our medical system will be overwhelmed. 5% of the this disease, patients get admitted to the ICU. 20% get admitted to the hospital. Now imagine we don't have as many beds in the hospitals, in the ICUs, to accommodate all of them. And the elderly and the sick and very sick may need ventilator support. And we don't have that many ventilator systems in the country. So the whole idea is to avoid overcrowding medical facilities. And the first step we can do is at home, and that is social distancing, stay away from people who are infected, stay away from people who you suspect may be infected, and report your contacts, report your travels, stop traveling within the country. Do not do any unnecessary parties, gatherings, and so on. Everything can wait for a few months. Unless we wait for the worst, unless we work for the worst, we're not going to be able to control it. We should have, in spite of being a democratic country, we should have a little more stringent rules for ourselves, just to save ourselves. And it's a matter of few months. It can't be that bad.
Okay, I'm reading a brief summary of a study that's been conducted by the Imperial College of London. And according to this study, they say that the self-isolation measures to suppress this virus may have to be maintained for 18 months or more until we're able to find a vaccine at least. Dr. Ban, what's your own sense? Are we in for the long haul?
Thank you for having me. So yes, we could be in for the long haul, but it very much depends on how we respond now. And I think that response is contingent on measures by the government. It's contingent on how we as communities and the public respond. I think what we need to also see probably is what is the history of viral outbreaks, epidemics and pandemics like we are seeing now. Though the viruses might change, I think there are a lot of lessons we can learn. And the lessons tell us that the sooner we adhere to norms like social distancing, ensuring that we have prevention measures on hand, and that we prepare our health facilities for the kind of onslaught which could happen if there is rapid spread, then we might be able to blunt the spread of the epidemic. Now, what we really want through these measures is to ensure that the spread of the viral infection is minimized to the extent possible. We've seen in cases like Ebola in Africa, in H1N1 in the past, that it's possible to blunt the spread of the epidemic if you are very much following the measures which have been asked for from a public health perspective. So I think if we get those measures right, there is a possibility that we will be able to prevent rapid spread of the infection, which could paralyze our health facilities, which could paralyze our society. And that would be something we would all worry about. There, certainly, then we could be in for a long haul. But if we get our steps right, I think there is quite a bit of possibility that we can control the infection. And yes, it could turn out and become another seasonal virus which we have repeated spread of, but it will not be a prolonged period where you have a continuous spread happening. And I think that is possible to do because we've seen that happen with previous viral outbreaks. And in cases like Ebola, actually the mortality was much higher. So if countries like Liberia, which are much poorer, have managed to actually do better, then it's certainly something which we should be looking at in India, that what can we learn from countries like South Korea or Singapore, which have managed to actually prevent the growth of the epidemic, which actually was in a much worse condition than we are seeing right now in India. And those lessons, how much of those can be imbibed for a country like India, which is fairly large in size with high density. But I think if we all come together as a community and work with the government, it is possible to prevent a worst case scenario. And I think that is what we should all be working towards.
All right. So let's say we prevent the worst case scenario. Let's say like how global experts have been saying that we contain ourselves in stage 2 and we don't reach stage 3. But one interesting point that many of you right now have made is to say that the infection isn't going away, that the virus isn't going away, and people can continue to get infected even 3 months or 6 months later, which is what we need to keep in mind. So it's not as if in 2 weeks or even a month later, Dr. Verghese, we will be in a situation where everything's fine and there is nothing to worry about because the infection stays and we still don't have a medicine or a vaccine?
Okay, I can't hear you at the moment, but I'm missing you, but...
No, Dr. Varghese, my question to you was, since there is no vaccine yet, can you hear me or are we going to just repatch that line? Okay, let's just attempt to repatch that line.
Yeah, I can now.
Okay, so the question is simple. The infection isn't going away.
I can hear you now.
Let's just say that we right now managed to contain it and reduce the number of cases, but a month or 2 months later, we still wouldn't have a vaccine and the virus would still exist. Is that something that is being factored in right now by the authorities and the medical fraternity?
Yeah, we are in for a little long haul. I don't think we are talking of weeks here.
Yes.
We are probably talking of a few months at the minimum. So it's a long, hard road. So that is what is difficult about it. So it has got huge economic impact in all sections of society and for the globe as such. So that is the hard part of things. Because I think it's being unrealistic to believe that it'll fade away in a few weeks. We are talking of a few months at the minimum. Now, regarding the situation will improve once there is what is called the herd immunity. But that herd immunity will come only when a widespread number of people get infected. Many of this will be subclinical infections or mild infections, and therefore the herd immunity will come at some point of time. So you can get natural immunity with infections, or you can get a vaccine. I'm optimistic, realistically speaking, that a vaccine will come through in a few months, because when we're talking of a global epidemic, there are thousands of people working in this area all over the world. And I'm optimistic a vaccine will come through much sooner than before. Okay, the Ebola, once people started working on it, they were able to produce a reasonably good vaccine. So similarly, when you are talking of a global epidemic, we are likely to get a vaccine. We may not be able to go through the phase 1, phase 2, phase 3 trials. It will have to be shortened, and I'm optimistic that a reasonably effective vaccine will come through, because I don't think there's any reason to believe that this is not an unvaccinatable illness. But even there, we are talking of probably about 6 months at the earliest.
You said herd immunity. Can you explain that concept to our viewers? Something that while the rest of the world is going into a lockdown and a quarantine mode, is a concept that United Kingdom is attempting. But for our viewers to understand, Dr. Varghese, what's the rationale behind herd immunity, and can it work in a country like us?
See, the concept of herd immunity is that when somewhere around 60% of people get an infection, whether clinical or subclinical, the virus will kind of tone down, and you'll get and will kind of settle. So that's the whole concept behind vaccination too. Rather than getting an infection and getting a milder disease or a less severe disease, in the early phases of many of these illnesses, you have to rely on infection. Okay, the infection is, as I said, in any viral infection, you can. The problem is that you can get asymptomatic infection, you can get mild infection, you can get a moderate infection, you get a severe infection in a small number of people. So it's the severe infections where people basically die. Now, if that ratio is small, we can just about get away. The whole idea of trying to flatten the curve is to kind of spread the number of infections over a longer period of time.
Dr. Shiban, do you think that's a concept that could work, especially with a country like us?
Yes, it has to work. We don't have any other choice here, because the vaccine, as Dr. Varghese says, is many months away. 6 months is optimistic. More realistic is maybe a year from now, even though the phase 1 studies have just started yesterday in the US. Still, an effective vaccine is many months away. So we have to really get prepared. And for a few months, how do we spread the disease proliferation at a slow rate so we can accommodate it within our facilities? If it spurs like it did in China, Iran, or Italy, then we'll be overwhelmed. So the wisdom is in the so-called social distancing and taking all the preventive measures, which are very simple. Anybody can do it, like washing your hands and escaping from crowded places and not getting in touch with suspected symptomatic people. And people just have to behave a little more normally. We should be doing all right then in the next few months.
So let me take this point further and try and visualize the setting for our viewers. Now we all agree that it's not a matter of few weeks. This could be many months until we find a vaccine, at least to say. Dr. Bhan, then say from 3 months from now, if we've managed to contain the infection, what would our lives be? We don't go to restaurants. Yep. We don't have large gatherings and festivals, but we still have to go to work. We still have to take the public transport. How will it pan out really, or what should we be expecting?
Yeah, so I think we have to prepare, one, for the long haul, and two, for our lives to fundamentally change potentially if we have a long run outbreak or epidemic scenario. But quite honestly, I think sometimes we have an overt focus on a biomedical solution, which is a vaccine which can be, say, injected for us to get immunity. But we have something at hand which is also a vaccine, and that's a social vaccine. And the social vaccine is actually a preventive methodology to prevent the spread of infection. And that, I think, we have described within the panel, just basic public health measures like social distancing, like making sure hygiene is maintained, like identifying suspected individuals with infection and encouraging them to get quarantined, isolating those with confirmed infection to prevent further spread. I think if we get all of those steps right, even while we are waiting for a biomedical vaccine to come through, which actually might take quite a bit of while, as was described, and even when it becomes available, there will be a resource challenge because you will have a limited number of doses. And depending on which company finally comes up with it and how many doses are available, you might have to do priority setting. How will we have a model of which country gets access, how many doses are made available, how do you decide who gets access to it first? So I think it's not going to be a very simple scenario because the number of doses which can be produced are also, there is a rate limiting factor attached to it. So I think what would be better for us to do is to get our public health measures right and await that biomedical solution to come through. But in answer to your question, 3 months down the line, if we are facing the kind of situation we have now with a rapid spread, then again, yes, absolutely. We would be fundamentally changing the way we live, with more and more of us working, if possible, remotely from home, avoiding contact with other individuals. And I think that is going to take a toll. I mean, right now we are only talking about a matter of a few days where some individuals have had to face this kind of scenario in some states because social distancing has been encouraged or instituted. But if we are in for the long haul, then folks will go through anxiety, they might go through depression.
Yes.
Mental health is going to be a major issue. We need to have support systems. At the heart of it is a solidarity response because there are the have-nots in our society, as was talked about, who will be struggling because for many of us who are more well-to-do, we might have access to financial savings, we might be in jobs which allow for us to keep earning. But those who are daily wage earners will struggle very much. Those who need to keep going to work will face risks on a daily basis. And I think that is where, as a society, we need to also think through. It's not just a health systems response, it's a finance response, it's a social justice response, it's a response which needs to cut across ministries so that we are prepared for a scenario which is a long haul scenario, and that collectively we try to ensure that we work together to address any of those inequities which might widen, and also ensure that everyone who might be especially vulnerable at this time, elderly living together, those who might be living in institutions, those who might not have access to financial security, that we find ways to plan to support them. Because otherwise, as we have seen in some countries, we might face a situation where those who, for example, are already having comorbidities, if they don't get the right medical attention on time, they could die of diseases which are not coronavirus or COVID-19 related. It's just because they could not get their regular medication on time because they were part of an area which was shut down and there was no access to services. So basic services need to continue, our support systems need to continue, our public health measures are extremely important, and let's work collectively in doing that. I think we have a strong chance of being able to then avert a worst case scenario. As I said, some other countries have shown us the way it's possible to do that. And then hopefully, time will tell, because it's difficult to predict right now with this new novel virus how it will react. But things like weather patterns, will that make a difference? The fact that strong public health measures could be helpful. And also, we'll have to wait and see how, as the summer sets in, how things will change. But I think we should be prepared for a worst case scenario of a prolonged infection, and make sure we have systems to respond to that.
Dr. Bhan, just this afternoon when the team was discussing how we should go about this evening's plan and what we should be discussing and focusing on, largely the conversation revolved around what you are right now telling us, and how we could be in for the long haul, and this could become a way of our life for several weeks and months. And which is why tonight, while I begin the show with having a conversation with the four of you about social distancing, the next one is again focusing on why we need to absolutely have a very, very strict law against mass gatherings, and then we focus on the economic impact for the world and for our country, and we'll have the principal advisor to the government speak to us about it. And then mental health, you're right about that. This is going to start taking a toll on individuals, on their peace of mind, on their mental health, and we need to prepare ourselves to work towards that. So let me ask Dr. Vyas this question, since China is the one that first got into this and has already moved a few stages ahead. How are the Chinese authorities looking where they are right now, and what seems to be their plan of action for the next phase?
Yeah, so now the next phase is that everyone who's going, like the work has been started. So everyone who is going towards their jobs, or those who are have to go outside, they have to show up a green signal, green code, or entry exit passbook whenever they go outside or use public transport. They have to regularly check the temperature, and those are the norms now. And basically, everyone has to wear a mask. Doesn't matter if they are infected or not infected. Hand washing has been compulsory. If you are going to your office or job location, they will sanitize your hands with the sanitizers and check your temperature. Again, they will check the health code, which is a kind of passbook or some kind of code in your mobile. So then they monitor everything. Others still they haven't allowed the restaurants to dine in, but for example, the other services, the industries and the factories, the manufacturing has been started just after 2 weeks of the lockdown. So the factory workers are already working in, and they have provided a facility, very highly equipped zone with good ventilation services, 3 times of spraying of the disinfection, and so like they have taken a very strict measures to further infection. Yeah, public is not allowed. But they encourage you, like if you're staying home, you should go outside to have some exercise. But no gathering is allowed in general.
Okay. Right, and like you said, the schools haven't opened yet, and that actually is the other thing that I wanted to talk about. Dr. Shiban, what would you advise that for younger children, can we afford to send them out again? How soon can we look at a situation of reopening our schools? I'm sure for a lot of parents, especially for those who are now in a work from home scenario, they want to know about what happens to reopening of schools.
If you take the Chinese experience, it's taken them 3.5 to 4 months to come to this stage. So I think we should be past summer before we open the schools. They'll give us next 2-3 months. Luckily, most of the schools will be going summer vacation now. So a little extra few weeks before or afterwards is not going to hurt that much. Hopefully, in the next 3-4 months, we should be able to open the schools going from the Chinese experience. And then hopefully we'll be able to contain the stage 2, in which case the community transmission is a little abated in our society, in which case we'll be better off than what I just predicted just now. Maybe we'll be able to open the schools even earlier. The key is doing the basics that everybody in this panel has said again and again and again, and no amount of repetition is going to be enough if we really want to change behavior of the people, and we should be at it all the time. And hopefully the economic effects and the mental health effects will be much less than what we all fear.
The one more aspect that I wanted to check with all of you, and this could get slightly controversial, but I want to know what your views are about how strict can we get about implementing the rules and the advisories that the government has put out. You have examples from China. We've also seen what's happened in South Korea, where the government was very strict about those who are being quarantined. There was GPS monitoring, and anybody who was breaking the rules was being punished and penalized for it. So, of course, in their country, it's easy to monitor every single person. Perhaps not possible in our country if the number of cases go up. But should we get stricter? Because even today we had mass protests, mass gatherings, some religious events are still going on, anti-CA protests are still going on, politicians are still holding their own events and public functions. Some of them want to hold elections, civic body polls. How do we ensure that that doesn't happen? Should we have stricter rules? Dr. Shivan, let's begin with you.
It starts with the leadership at the top. I'm all for stricter rules because it's going to benefit everybody. This virus is not going to discriminate between a senior politician and a lowly party worker. It's not going to differentiate between the rich and the poor. It's not going to differentiate between various religions. It's going to affect us all. And this one, we truly, truly have to come together and don't do anything stupid. Stupidity is a crime at the moment. It may not be punishable, but definitely it should be socially outcast.
Mm-hmm. Yes, I think so.
Leadership has to come from the top to really set an example. And they can't expect the general population like us to give the leadership in this crisis. That's what leaders are made for, to lead the nation in the crisis.
Yes, absolutely. Dr. Varghese, I'm going to attempt try coming to you. My apologies, we've had a very tough, tricky audio line with you, so we've not been able to bring you into the conversation for many minutes now. But do you think we need stricter rules and stricter implementation in our country if we are to fight this virus?
At this phase, we need stricter rules. I need to bring in a little bit of optimism into this debate, in
Please
the sense
do.
that if you look at the story of the SARS epidemic, it suddenly died down. Okay, it lasted for a few months and died down. So it's too difficult to say where we are going. But if it's spreading as we see it spreading in other parts, it is certainly distressing and is going to tax the system hugely. So at this point of time, being tough on things, on curtailing certain activities which are not absolutely necessary are very important. Once it comes into the community, it may not make too much difference on what happens. So the point is to try and prevent community spread as best as possible, and that's what these current measures are. and to try and flatten the curve of the epidemic. And this is very crucial at this stage. So politicians, leaders, etc., all need to be aware of it. The globe is very leveling at this point of time. The whole globe has to come together and is coming together. And that's why I'm optimistic. And as I said, I'm optimistic also, though theoretically a vaccine could take longer, I'm optimistic that a vaccine could come sooner than expected. I'm also optimistic that for unknown reasons, the epidemic may suddenly decide to die down, as happened to SARS. So there is a precedent. SARS is a very closely related virus, and it suddenly died. Okay, so I'm optimistic. But in the meanwhile, we have to be empathetic to all sections of the population. People are going to suffer, and we need to give them a genuine helping hand. Okay, and we cannot afford to be selfish about things.
Yes.
We have to be generous. That's the only way to go.
Yes. Well, I would just simply add to that if we have to be selfish or a little bit more than that, it should be towards those who disregard the rules, who disregard the advisories, or who refuse to follow the norms of social distancing, thereby not only putting their own lives at risk, but putting the lives of many, many others at risk. I have a viewer on the phone line, and he has a query for our experts. Alfred is calling from Mumbai. Good evening, Alfred. Go ahead, please.
My question to any one of the panelists is, in case...
Yes?
Can I go ahead now?
Yes, please. Go ahead.
Okay. My question is, in case there is a person who recovers from this infection and that person leaves quarantine, can he possibly be infected again? And so, if so, would he be part of the chain of infection again in society? Or will that infection be of lesser intensity? And that's what I would like to know.
Okay, interesting question. Dr. Ban, would you want to respond to that? Can somebody who's already gone through the process once, can he be infected again?
Yeah, so there seems to be some evidence to indicate that reinfection is a possibility. I mean, there is a little bit of confusion on the science here. Some people speculate that it might just be the case that your viral load goes down and there is some element of infection remaining, which might resurface, whereas there is some other evidence which indicates that reinfection is a distinct possibility, which does, there is a slightly scary perspective there, because that would potentially mean that you don't really get quality immunity through exposure and that you are still susceptible to reinfection. So I think the measures need to remain the same, which means to say that just because you might have recovered from infection and have been certified, so you still will need to follow those prevention methods, because till we know whether there is a possibility of getting reinfected or not, we should be taking all adequate precautions, because not only are you going to put yourself at risk, but those around you, your loved ones, your contacts, and the society around you at risk. On your other question, which I think is an important one, yes, absolutely. I mean, public health measures sometimes require you to suspend individual liberties, and that is an important measure, and it can get very strict. And it's not that we haven't done that in India, right? We have a whole lot of experiences with instituting curfews or bans. We have suspended civil liberties in parts of this country for long and done it quite effectively at that. So it is possible to do it, but at the heart of a response like that is also a requirement for reciprocity. And what I mean by reciprocity is that if you are suspending anyone's civil liberties, like for example putting them in isolation or quarantining them, then you need to ensure that you provide them with a minimum set of essential services. So obviously food, water, clean accommodation, ensuring that they have access to communication, that they are able to reach out to their loved ones, that they know what is happening to them, that people who matter to them have access to that information as well, and that they are updated on a regular basis, they undergo medical checkups. So you cannot abandon people and say, well, you need to be self-quarantined and just, no one will take care of you. And if you, for example, if you are having a disability, then you are not able to go out and access any service. The state will need to step in, society will need to step in. But yes, you can suspend civil liberties, but you have to be responsive to their rights as well. When you recognize that when you do that, then as a state and as a society, you have to respond to their basic needs at the same time.
Yes, absolutely. It's been a pleasure to have all four of you with such great insights into this, joining us this evening and helping us understand just what it is that we are staring at and what we should prepare ourselves for. We are in the long haul. For all of you who are working from home, for all of you who can't go to your gym, can't go to your office, cannot travel abroad, have had to cancel your vacations, have your children at home, can't go to school or to the playground, and you're wondering just how long this is going to continue. Well, the governments and various state governments have brought in these advisories for a couple of weeks, but here are the experts who are telling you that we will probably need to do it for many months in order to ensure that there is minimum damage from the coronavirus. Of course, that will mean a larger impact on our economy, on our lifestyle, on the way we've been living, and of course, on our mental peace. All of that we will help you to tackle. But suffice to say, perhaps we are in this for more than a couple of weeks. On the other side, Sri Ravi Shankar tells us how to tackle social distancing, how to lead your life in such a scenario. Stay with us.